this is Dr. Rutledge from the beach in Tijuana, Mexico. All is well. I just got off the phone with a patient, and she had posted something on our Mgb Facebook page, and she said, I passed out. So I said, please call me right away if you don't mind. And it turns out she did. And it turns out she had surgery with me about 11 years ago. She was 300 and some pounds and now is 100 and some pounds. So she's lost about one human being about 11 years ago. So that's good. And she began talking about what's going on, and she mentioned salt. And so there is some confusion. My old videos on YouTube still say that, you know, we need lots of salt and salt is good. And in fact, early after surgery, there is what's called a massive diuresis. And what that means is the body loses a lot of fluid because the obese body, the heavy body, is sick. And so it's like getting a blood dose of a diuretic or a pill that causes fluid loss. And so a lot of the weight loss in the early month after surgery is a low salt. And in fact, the Mgb helps by lowering blood pressure and excreting extra salt. So in the early phases, you might need to take some extra salt. As your body adapts over time, this extra salt need declines. So I didn't think it was going to be that. And when I talked to her, she mentioned a few things. One is that she's had this worsening over a past year. She's kind of not quite middle-aged, and she had a history of low iron when she was a child and trouble keeping it up. I asked her if she was following our old manual and taking her vitamins and things like that, and she said no. And in a gentle, loving way, I scolded her just a bit. And then I said, are you taking your vitamins and things like that I had mentioned to you in the past? And she said no. And I said, okay. So I think we might know what's wrong. And the other thing she mentioned is that the passing out event occurred after coming out of a hot shower. And all those things add up to a fainting episode. And the probability that I think, and I mentioned to her, is low iron. And there is a lot of people who get confused about this after the Mgb, and they start talking to their doctors who can be confused about it. And so we're going to go over a few of those things today. First of all, the Mgb bypasses the duodenum. That's the first part of the small bowel right after the stomach. And that is the area where most of the iron is absorbed. And so what we see is some people get low iron after the Mgb. And so then we get some people who will talk, either patients or doctors will say, everybody needs to take a lot of iron. It's important to take iron, and you need to eat red meat and beef and all kinds of things to get your iron in. And I'd like to put a little bit of a slight variation on what I think is the actual best recommendation for your long-term health. So first of all, on our Facebook page, where I presume you might be watching this right now, please go and talk to anybody and everybody who has low iron. What I think you'll find in my experience with thousands of patients over 20 years is some people do get low iron after Mgb, but you can tell who's at risk just by looking at somebody. So if you look at them, you can tell right away whether they're at high risk or low risk of getting low iron. And the way you tell is you look at them and see, are they a man or a woman? Oh, if you're a man and have Mgb, you rarely get iron deficiency anemia after the Mgb. It happens, and that's a special case, and they should talk to me. But in general, men don't get iron deficiency anemia after the Mgb, and women do. So what's the difference? Well, the difference is menstrual cycle. So women are losing iron, losing blood every month in the menses. And with that comes along an increased risk of anemia. Now, a lot of doctors treat this by giving extra iron. Well, so let me give you an analogy. Treating excess blood loss in the menstrual cycle in women with extra iron is a little bit as if you had a bucket in your backyard, and the bucket had a hole in the bottom, and you wanted to keep water in that bucket. The solution is, by giving iron, is you can add more water. But there's a hole in the bucket. And so many physicians and surgeons and patients are busy putting more water in the bucket as a solution for the problem of a hole in the bucket. Now, another thing that's very common is women get anemia without Mgb. And mostly that is called Menometrorrhagia. And we're going to go to the treatments for Menometrorrhagia, or excess menstrual bleeding, because we do not recommend constantly filling up the bucket with water. We do think some supplemental iron is a good idea in everyone, but in general, having a slightly low but normal iron is better than having a high but normal iron for long-term health and heart benefits. So let's look at what I recommend as the treatment for low iron after Mgb. First of all, look down. You're probably a woman. If you're a man, then I would call me, because the rest of this discussion is not for our male patients. But for our female patients, what we think you should do is, in this analogy, patch a hole in the bucket, okay? Don't get tons of intravenous iron and take pills or eat beef or all kinds of other things that you get advice on. Instead, the first thing you should do is cut back on the blood loss. That is, patch the hole in the bucket. That's the first thing. And we're going to talk about the various options. And they're very simple. And so we'll talk about that. So I'm going to share my screen. And now we're going to talk about this section here, which says how Menometrorrhagia is treated. That is, what to do if another woman, not an Mgb patient, has a leaky bucket. Okay? And there's several choices, and I'll give you kind of my bias. But what they say, first of all, is it turns out that the amount of blood loss can be changed if you change the inflammation in the woman's body. Okay, so medicines, as it says here, such as ibuprofen, which is an anti-inflammatory pill, can reduce blood loss during your period. And there's a whole way of doing that. And they mentioned it also may help with cramps. But anti-inflammatory drugs are easy to use, but they have their own side effects. And so there's a whole other lecture on an anti-inflammatory diet. That is, eating a more healthy diet. Eating a more healthy diet decreases inflammation. Inflammatory foods include meat, dairy, eggs, and other similar kinds of foods. So by moving towards a healthier, what's called a whole food and plant-based diet, you may decrease the hole in the bucket. That's number one. If that didn't work, again, in concert with your gynecologist or your doctor, you could add ibuprofen as well. The second thing, and the one that I usually see work best, is to take some oral contraceptives. Now, some people are in the process or wishing to have a child, in which case oral contraceptives might be something you don't want to do. Well, you don't want to try and conceive a child when you're already anemic. So it's possible you might want a year of therapy, maybe intravenous iron or whatever. But if you want to conceive a child and you're having low iron, I would have discussions with your gynecologist and potentially also call me directly so we can discuss how you might want to manage this. But for everyone else, the oral contraceptives cut out or markedly decrease the blood loss in the menstrual cycle. And that's what we want. And I say in a, I hope it's not an offensive way, we want to make women more like a man. Okay, I apologize. All we're saying is men don't get anemia after Mgb except for very rarely. And if you could stop leaking the blood in that monthly cycle with some oral contraceptives for a period of time, you would also be protected. So you would get, in this woman's case, 150-pound weight loss for more than a decade. And the only thing she has is what she had when she was a child, which is, I think, iron deficiency anemia. I think that's a fair trade-off. Another female hormone is progesterone. And again, this can often reduce heavy bleeding. There's another medicine, I'll highlight it here, called tranexamic acid. This can slow down menstrual bleeding, but and you only take it when you're bleeding, but it's not my favorite choice. One of the new ones that a lot of my patients are having good results with and like, and that is hormonal IUD or intrauterine device. And that works really well and doesn't require any pills, and also gives you a lower total body amount of the hormones that you're getting in your body because it works locally. Another thing, of course, is you want to do iron supplementation. Like my patient who called this morning hadn't been taking any of her medicines or gotten her blood test. So hopefully she'll get all that taken care of. The other thing is you might not have a problem from an MGB. You might have what's called a uterine fibroid or fibroids. And those abnormally shaped benign tumors in the uterus can be affected. And if they go away, maybe the excess blood loss will go away. The other thing is sometimes they're actually taken out surgically. And sometimes actually the lining of the uterus, if it's bleeding so much, can be interfered with. So they call it ablation of the lining. And occasionally in some people, if it's so severe, they'll actually proceed to the radical approach of actually removing the uterus. Anyways, in the majority of my cases, the patients that I care for, it's the best treatment is birth control pills or the new hormonal intrauterine device. Both are really simple, and we see lots of local medical doctors, patients, and even bariatric surgeons who are confused about this topic. And I'll remind you once again that one of the best treatments is to consider a anti-inflammatory diet, because most of the MGB women don't get iron deficiency anemia, a higher percentage than men, but a lot of women are just doing fine. And I think it's related in part to the inflammatory nature of the animal proteins. So overall, I hope this is interesting. Don't hesitate to call me or email me or contact me on Facebook Messenger. Thanks very much, and goodbye.